Do you have health insurance through the Affordable Care Act? Your costs may be about to skyrocket. Welcome to Care Talk, where we talk about how healthcare works or doesn't work in America and answer your health insurance and healthcare questions. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your questions at 202-838-6837, and we'll answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's show. In today's episode, healthcare expert Charles Gaba explains why you may be getting sticker shock for your health insurance policy in the next couple months and what Congress could still do to help you. So, welcome, Charles, healthcare policy and data analyst and founder of ACAsignups.net.
Well, thank you for having me. Appreciate it.
So, let's start with how did you get into the healthcare policy world in the first place?
Oh, okay. Well, by accident, honestly. I was a website developer for about 10 or 12 years, and I'm also kind of a data wonk. And back when the Affordable Care Act was winding its way through Congress and kind of sucking up all of the oxygen out of Washington, D.C., I got very interested in it. And when the first open enrollment period launched in October of 2013, and there was infamously, there were all sorts of technical problems, the website crashed and so on. I was really interested in finding out, well, just how many people are actually signing up for this after all of the, debate and arguments over it. So I just started tracking it myself, essentially. And one thing led to another. Next thing I knew, I sort of became Obamacare Central. A lot of healthcare reporters and analysts and insurance folks and such started following what I was doing and my data. And it just sort of grew from there to the point that what was originally supposed to be just a short-term hobby and has actually been my turn into my career over the last decade. As I've learned from actual experts who know what they're talking about, I've learned a lot about how the health insurance industry works, the policy works, and so forth from a lot of experts. And so just kind of went from there.
So, let's talk about what's going to happen to the Affordable Care Act. I use it for my insurance, and you do too. So we have personal stakes in why our premiums are going to increase this year. So tell us, what is the problem? What is happening?
Okay, well, there's a couple of things going on. The biggest sort of issue facing us is that the enhanced subsidies. Let me back up. So the ACA exchange policies, which has around 24 million Americans are enrolled in health insurance coverage through the various ACA exchanges, healthcare.gov in most states. Other states covered California. Some states have their own exchange. But there is a sliding scale premium subsidy program in place for that. So, as you basically for folks who earn at least the poverty level or up, as your income goes up, the subsidies become less generous. And that's always been the case since the ACA was first passed. However, the original formula for the subsidies was generally not generous enough for a lot of enrollees, and it had a hard cutoff at 400% or 4 times the federal poverty level, which this year I believe that's around $62,000, $63,000 per year for a single adult. And I think it's like $130,000 or so for a family of 4. I'd have to look that up. But if you earn even $1 over that 400% cutoff, you weren't eligible for any subsidies. You had to pay full price for your health insurance premiums. In 2021, the Biden administration and Congress, they passed the American Rescue Plan Act, which as part of it included a significant bump in the generosity of the subsidies. Basically, it made the formula considerably more generous, and it removed that 4 times poverty ceiling. So subsidies still taper off as you go up in income, but they taper off at a more gradual rate instead of just being cut off all at once. That was put in place for a couple of years under the ARPA, and then the Inflation Reduction Act a couple of years later, that extended those improved subsidies by another 3 years. However, those 3 years are up at the end of this year. So as of December 31st, 2025, less than, about 5 months from now, the ACA subsidy formula will revert back to the original formula, which means that for those 24 million or so people, just almost all of whom are subsidized, I think it's something like 92, 93% of all ACA exchange enrollees do receive at least some level of financial assistance. They're going to revert back to the old formula, which was considerably less generous. And for those who earn more than 400% of the federal poverty level, they'll go back to not being eligible for any financial assistance whatsoever. And all of this will kick in starting on January 1st, unless Congress chooses to extend the upgraded subsidies, by another year or 2 years or 5 years or permanently or whatever. So if that does happen, then it's a different story. But if that doesn't happen, then starting January 1st, there's nearly 24 million Americans who are going to be in for a very rude awakening.
And possibly, yes, possibly you and me.
Yeah.
So when are we going to find out what they're going to charge us for next year? When are we going to find out just how much our premiums are going to skyrocket by?
Well, every summer and early fall, I do an annual rate filing project where I'm basically tracking the official legal filings and governmental filings by the various insurance carriers, where they say they file how much they plan on charging for the policies for the upcoming year. But that's an ongoing process that stretches out several months, and there's preliminary and reviews and so on. But the final hard numbers, those won't be known for another couple months. And generally, the insurance carriers are required to send out notices, letters, email, what have you, to all of their existing clients, their existing enrollees, letting them know, here's how much, dear so-and-so, you're enrolled in such and such plan policy. Here's what this same plan will cost you next year, or what we expect it to cost you next, starting January 1st. Those notifications are supposed to go out in, I believe, either late September or early October, because the actual open enrollment period launches on November 1st. So it's roughly a month before is when they start sending out those notifications. However, it's important to understand that those letters, and this has always been the case, those letters can't be exact because there may be changes at your end. If your income fluctuates, if you have a child, if there are changes in your household, if you move, things like that, that can change, what you pay, what your premiums are, what your subsidies are. And also, of course, if you switch, that all assumes that you're re-enrolling in the exact same plan you are, this year.
So can Congress do something about this problem, or is it too late?
No, it's not too late. I mean, for example, the original ARPA, that was actually passed in March of 2021. And so those upgraded subsidies, those were actually made retroactive to the beginning of the year. Of course, that was in the middle of the pandemic. It was part of one of those, sort of emergency, public health sort of sweeping policy changes. But it was very messy. And so, yeah, they could still do this. I mean, between now and the end of the year, they could pass it perhaps as part of the next, upcoming battle over the debt limit, things like that. And if they were to do that, what would probably happen at this point? What would likely happen? Let's say that they were to pass that in October. Let's say just shortly before open enrollment launches. What would happen at that point is the final contracts with the insurance carriers are generally locked in I believe, in mid-September each year. So the higher premiums, the higher unsubsidized premiums would be locked in at the higher rate. However, the subsidies would still be more generous, and so most enrollees probably wouldn't see too much of effect. There would be some impact. People who are unsubsidized, for example, they would still see somewhat of an increase in their costs, but it wouldn't be nearly as dramatic as what they're likely to see if the enhanced subsidies are not extended, and that can be extremely dramatic.
Mm-hmm. And so regardless of the subsidies, which most people, but not everybody qualifies for, the insurance companies are going to raise their rates more than usual because of all of the sabotage by this administration to the Affordable Care Act, right?
Yeah, and that's the thing, and it gets a little tricky when you're talking about, for example, I've analyzed about 20 states so far, and their official unsubsidized rate filings, on average, they're saying that they're asking to raise rates by about 20% on average, higher, lower, but that's the average. Now, that's again for unsubsidized premiums. That's assuming you're paying full price, and that's comparing this next year versus this year. If you are receiving a subsidy, however, that does not mean that so that means if you're not receiving a subsidy right now, you're likely going to pay 20% more, which is pretty bad already. However, if right now you're receiving subsidy, which again the vast majority of ACA enrollees are, how much more you're paying than what you're paying now could be far, far more than that, because your subsidy would be reduced. So, for example, and I have a whole bunch of examples for different states and different households. There are some people who they might be paying $5 or $10 a month today. If they're pretty low income, it's a fairly nominal $5 to $10 a month. Let's say that same plan with the reduced subsidies could go up to like $80 or $90 per month. And if you're at that low, so you're going up like 8 or 9-fold versus what you're paying today. But also for people who are unsubsidized, who are just over that 400% of poverty, cutoff. If you're at, say, 401%, you're just over the cutoff. Today, you are limited to paying no more than 8.5% of your annual income for the benchmark silver plan. That's sort of the flagship policy. You remove that, if you remove that, or if you bring back that cap, it's called the subsidy cliff, or it used to be called that, and apparently will be again if this happens. You would be going back to paying full price, which could mean going from paying 8.5% of your total income to 20%, 25%, 30%. I have some in some states, and some extreme examples, there are people who might be paying literally half their income, 50% of their gross income just for the premiums. Of course, nobody's going to do that. Nobody can afford to do that, which means that in those cases, those people are most likely just going to end up having to drop their coverage entirely.
Mm-hmm. And as we've had several guests talk about with the cuts to Medicaid, more uninsured people raises the costs for everybody, because people still need healthcare whether they have insurance or not. And hospitals and so on will provide emergency services, which is the most expensive way to deliver care. So not only is this going to bankrupt individuals that lost their health insurance, but the entire system, the costs still need to be paid for, and then it's costs that the rest of us will have to pick up.
Yeah, absolutely. That's the thing, is there no, it's like squeezing, one of those toys they give for, like, fidget balls or whatever. If you squeeze at one end, it's going to expand at the other, or a water balloon, let's say. And it's all part of the same system. So it's going, so things that impact 24 million. If you're not on the ACA, you say, okay, I'm not one of those 24 million. Yeah, you have employer insurance, let's say, which roughly half the country is employed through is insured through their employer. Yeah, but the insurance carriers, they're going to have to make up, the hospitals are going to have to make up the losses, and that's going to be made up for in their negotiations with the insurance carriers, most of which are going to be employer insurance, which means insurance premiums are going to go up basically to eat those costs, which means that your premiums, or your share of premiums that you pay, through your employer plan, is going to go up as well. So it's in some cases it'll be an indirect connection, but yes, there is definitely a very clear line connecting all of these things. And as you said, the same thing with Medicaid. People who are kicked off of Medicaid, it's the same thing. You have millions of people through Medicaid or ACA. If they lose their coverage, that's still going to raise the cost for everybody else.
Exactly. Healthcare is not like Social Security. This is not a check that people are getting to spend however they want. Health insurance through Medicaid, et cetera, is providing care to people who need it. And if you still have a heart attack or a stroke or a car accident or get diagnosed with cancer, just because you don't have insurance, you're still going to show up at the hospital. That money still is going to come from somewhere, except now that $1 trillion have been cut, everyone else that has insurance will have to pay more to make up for it, or hospitals will just start closing and providers will stop providing because the math doesn't work anymore.
Absolutely.
So, given that we are on the Titanic, we are steering straight for a lack of subsidy iceberg, and Congress still could turn the ship to avoid that iceberg. What all should we be doing?
Well, I mean, I would certainly be contacting your member of Congress, House, your representative, and both of your U.S. senators to, extol them, to ask them to please extend these enhanced subsidies. I mean, personally, I prefer they just be made permanent, but certainly extend them at least by a few years. I would also contact your state representative, your state senator, and your governor, because there are a few things that there are some states which are sort of trying to take measures to try and mitigate the damage. And some of them can and will to some degree, I'm sure, but it's, you're talking about a small fraction of the amount of funding that we're talking about here. But there are a few things that they can do. So, basically contact your representatives and senators and ask them to extend these subsidies.
Well, thank you very much for joining us, Charles. Where can people find you on social media to get the latest updates on what's happening with health insurance?
Sure. Well, again, my main website is, as you said, acasignups.net. But I can also be found mostly on Blue Sky, simply at charlesgaba.com. Or I do still cross-post to other platforms on Twitter or X, whatever it's called. It's Charles_Gaba. It's usually some variant of Charles Gaba in there. It varies from platform to platform, but primarily Blue Sky would be your best bet. Again, it's just at charlesgaba.com.
Thank you very much. And now, welcome Diane Archer from Just Care and Social Security Works to answer your Medicare questions. So let's start with a question from Philip for last week, who, it's actually more of a comment, who is upset that he's forced to take Medicare, that he had good health insurance probably through his employer, but when he turned 65, he had to take Medicare and it didn't even cover my hospital bill. And my good coverage is now secondary and he had to pay a couple $1,000s out of pocket. Diane?
Sure. So as people turning 65 need to know, if you enroll in Medicare in the 3 months before you turn 65, you become eligible the first day of your birthday month. But if you wait until your birthday month or later to enroll in Medicare, then you end up getting Medicare later on. So I'm assuming, Philip, that you enrolled sometime after your birthday month or on your birthday month, and there was a gap in your coverage to your knowledge. But let me say that your private coverage is not secondary if you don't have Medicare. So it's more than likely that that coverage should pay your hospital bill if your Medicare coverage really hadn't kicked in. If your Medicare coverage had possibly kicked in, it's best that you contact a state health insurance assistance program for free help, and they can get that bill squared away for you and things working so that you don't have to pay out of pocket. You can call 1-800-333-4114, 1-800-333-4114 for free help from the Medicare Rights Center. I also want to say that back in 1965, when Medicare was started, it was because half of older Americans were unable to have health insurance. It was either unavailable or unaffordable. And we were a much kinder and gentler country then. Health insurance was expensive, but it wasn't nearly what it costs today. So I do believe that if we didn't have Medicare, we would find that probably, except for the 1%, nobody would be able to either get or afford their health insurance. And I say, thank God for Medicare. If you're in the regular Medicare program, you have coverage, easy access to care from doctors and hospitals throughout the country. There's no prior authorization requirements. You get the care that your treating physician believes you need. And then there is coinsurance, but that gets picked up by supplemental coverage if you have Medicaid or if you buy it in the private market. So I say Medicare is a national treasure, and we should thank God for it and hope that we can make it and keep it strong and make it even stronger than it is.
Thanks. And our next question is from Sharon, who wanted to know, is Part G of Medicare in jeopardy from the budget cuts from this recent budget bill?
Okay, great question, because it follows nicely from Philip's question, right? So basically, Medicare covers 80% of your healthcare costs, your physician costs for sure, and then a big chunk of your hospital costs. But there is a gap in your Medicare coverage, and that gap can be filled by what is called Medigap or Medicare supplemental coverage. Plan G is the most rich form of supplemental coverage. It picks up almost all of your out-of-pocket costs in traditional Medicare. And that you can continue to buy. The Trump budget bill, a reconciliation bill, tax bill, did not touch your Medicare supplemental coverage. And if your state gives you the ability to buy Plan G, you can continue to have that plan.
Good. And next, let's talk about why Medicare Advantage can be deadly.
Okay, great question. So I thought that maybe today we could talk about one of the big issues with Medicare Advantage that is directly hurting physicians and hospitals and indirectly endangering patients. And that is that the government wisely pays the Medicare Advantage insurers what it would cost to treat people in the regular Medicare program at those rates. But unwisely, it has allowed the insurers to pay hospitals and doctors below those rates. And insurers, who are always looking to maximize profits, are increasingly paying below Medicare rates when they can get away with it, which means that the less desirable physicians are the ones who tend to be in the Medicare Advantage networks, and the ones who are willing to take the Medicare rates, which are lower than the commercial rates, but are not willing to go any lower, are refusing to stay in network. And so what is happening as a result of that is that people are losing access to care. Now, let me step back a second, because this gets very confusing very quickly, and say that the reason I wanted to focus on this is that there's a new bipartisan bill in Congress to correct this deadly problem with the Medicare Advantage program. The bill is designed to ensure that the insurers pay physicians and hospitals at least as much as they pay them in traditional Medicare. And it's also designed to ensure that the Medicare Advantage plans pay these physicians and hospitals promptly. And this is a really important bipartisan bill, because what has happened is, as a result of the lower payments that the Medicare Advantage insurers are making, hospitals are losing money, physicians are losing money, people are losing access to these hospitals and physicians because they can't afford to continue taking Medicare Advantage. Sometimes the hospitals and nursing homes and rehab facilities are forced to close because they can't sustain themselves on the low amounts of money that the Medicare Advantage insurers are paying them. So it has become quite a nightmare, sort of endangering rural communities, inner city hospitals, and just the physician community and the hospital community writ large. The insurers are trying to use whatever mechanisms they can to hold on to as much money as they get from the government as they can. And that means denying care inappropriately, delaying care inappropriately, underpaying doctors and hospitals, paying them 90% of the negotiated amount or 80% of the negotiated amount, sometimes even less than that, and leaving these providers sort of hanging. So if you're in a Medicare Advantage plan, you need to be concerned that the doctors in the network, the hospitals in the network today may not be there tomorrow. There's a lot of movement. And we need, if we're going to have a strong Medicare Advantage plan, we need a Medicare Advantage program, we need to make sure that the doctors and hospitals in it are paid appropriately and adequately.
So there's this bipartisan bill, and I assume that doctors and facilities are also pushing for this bill because right now they're being underpaid by Medicare Advantage. So the main opponents of the bill are the Medicare Advantage insurance companies that are profiting off of the problem.
Yes, I haven't read about that, but absolutely, you're right. The provider groups are definitely in support of this bill. They want to get paid appropriately. They need to get paid appropriately. And everyone with Medicare and a Medicare Advantage bill and a Medicare Advantage plan should be supporting the bill because they want to make sure that their doctors and hospitals are paid adequately so they can continue to see them. But absolutely, you're right, Laura. The insurers are making larger profits, returning more money to shareholders, making Wall Street happier as a result of deals that they cut with providers for less than the Medicare rate, and as a result of just deciding to deny or delay payment to providers after the fact. And that is a problem.
So it sounds like some of the Medicare Advantage insurers not only profit by delaying and denying care to patients by making people jump through prior authorizations by refusing to cover treatments, but they're also making money off of delaying and denying payments to the providers themselves.
You've got it. You've got it. That's why you're seeing these, tens and hundreds of billions of dollars in profits in this Medicare Advantage program for the big corporate health insurers.
Is this part of the issue of Medicare overpayments to Medicare Advantage insurers, or is that a separate issue?
That is a separate issue. So this is the reason why this bill is so important and makes so much sense is that Medicare assumes, or the government assumes when it pays the Medicare Advantage plans, that it will pay Medicare rates and not lower than that. And that's why the payments they make to the Medicare Advantage plans are based on the rates that they pay in traditional Medicare, which is the government administered program that pays the providers directly. So yes, that payment is not something that the insurers are overpaid on. What they end up being overpaid because of a separate issue primarily, which is that they are making their patients look sicker than they are. And then as a result, the government has to pay them higher rates for those patients who end up being actually no sicker than patients in traditional Medicare who cost the system a lot less to treat.
So if people support this bipartisan bill and making sure that your doctors and providers under Medicare Advantage get paid fairly, what should people do?
People should call their members of Congress and say, you should support this bill. This bill is only fair. I want to continue to see the doctors and use the hospitals I use in my Medicare Advantage plan. And lots of them have been pulling out, really lots of them. This year alone, I just read, I think it was 27 healthcare systems have pulled out of their Medicare Advantage contracts in 21 states. I mean, this is not good. This undermines continuity of care for people. And so if you're worried about not being able to see your doctor or use the hospital in your community, absolutely call your member of Congress and tell them that there's a bill out there that they need to look into that would ensure that providers are paid appropriately in Medicare Advantage.
Well, thank you very much, Diane. And thank you, everybody, for joining us to learn what's happening with Affordable Care Act health insurance premiums. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.